we're already getting an idea of just how busy this hospital is. Just got the all clear signal.
I'm a trauma neurosurgeon. After decades of treating people in pain, people all around the world,
You can get an idea of just how challenging.
I thought I truly understood pain and the life-changing toll it takes. That is, until now. I'm Dr. Sanjay Gupta. It doesn't have to hurt. You know the expression, it's all in your head? Well, actually with pain, it absolutely is. The brain is your pain center, not the place where you actually injure yourself, your stubbed toe, broken wrist, or pulled muscle. Pain is created when signals travel from the point of injury to the brain, and then your brain reacts with sensation of pain. It's why everyone reacts so differently to pain, because everyone's brain is unique. Two people with identical injuries on an X-ray could have completely different perceptions of pain. And it's that subjectivity that makes pain, especially chronic pain, so hard to treat. I'm about to take you on a trip inside the brain. 3.5 pounds of the most mysterious tissue in the known universe, with more connections than stars in the sky. And hidden in that big galaxy of stars are the connections that create pain.
It's mind-boggling, right? More than a needle in a haystack.
Dr. Prasad Trivalkar will be our guide. He's a neurologist, a pain doctor, a trailblazer, and he is searching for the mystery of pain inside the brain.
So for the longest time, pain was called the fifth vital sign, right? But unlike the other four vital signs, there's no objective measure, right? It's not like temperature or heart rate. So one of the holy grails of pain medicine has been coming up with a biomarker for measuring how intense or how severe somebody's pain is. This is exactly an example of the device that...
So Trivalkar has made this his life's work and has an audacious plan to try and measure pain. To start, surgery, to stick multiple probes all over the brain.
Like it's this device kind of goes above, under the scalp, and connects to one of the wires going into the brain.
Scientists then simply listen to the billions of neurons in the brain and see what areas fire up when the patients have pain.
And we're targeting key areas.
I told you, it's audacious, about as cutting edge as it gets.
So telling someone you're going to drill holes in their skull, it should raise concern.
So they tell you all this, and your first reaction is what?
I'm having fun of
Click.
Yeah, no way. Ain't happening.
After being a real daredevil in his early years, 54-year-old Ed Mowry had collected a lifetime of injuries and a lifetime of pain.
34 surgeries.
Mm-hmm.
Wow.
11 knee surgeries. I've had my right knee replaced. I've had C3 to T1, L4 to S1, all fused, all new discs.
Initially, Ed would heal and the pain would subside. But then starting in 2009, after knee surgery, a relentless pain developed like he had never felt before.
Unbelievable burning, just nonstop. Think about the worst burn you've ever had in your life and multiply it by 10 or 20, and then it never, ever stops. Yeah, it's, it feels like someone's cutting the bottom of your feet. It's quite painful. I would say it's more than painful.
It took 10 years and lots of doctors for Ed to be diagnosed with complex regional pain syndrome, or CRPS. It usually occurs after an injury or an operation, and while it can occur anywhere in the body, it usually affects the hands or feet.
So in a sense, maybe it was the surgeries, but it seemed to have started you on the cycle of pain.
Yeah.
Now you might wonder, and so did I, if the surgery that kicked off Ed's chronic pain was in his knee, then why was the pain now so profound in his feet? Well, the best way to think about this may be like the phantom pain of an amputee. That's pain in a limb that no longer even exists. After all, Ed had no cuts or bruises, no visible injuries. This pain was being completely manufactured in his brain.
Manufactured pain from the brain with no stimulus, it's unreal.
So that's just your brain creating the pain?
Yes. The Lyrica and the morphine will be first.
He did try a very long list of pain pills.
And these are all the ones that I was on.
God. So hydrocodone, Norco, Celebrex, Vicodin, Percocet, oxycodone, Dilaudid, Demerol, Tramadol, Temazepam, gabapentin, methocarbamol, baclofen, Valium, Flexeril. I don't even know this one. Did you ever had zero pain even when you were on these meds?
No.
Eventually, he had enough and was willing to do anything, even brain surgery.
I thought, let them do whatever they got to do just to get me out of pain.
In the fall of 2024, Ed had electrodes implanted deep into his brain.
You're seeing here Ed's brain, and all of these little colors represent probes.
And there are as many neurons in your brain, if not more, than there are stars in the sky.
Yeah, exactly.
It's like throwing a telescope up at the sky and just seeing what you see or hearing what you hear.
Yeah.
It's
That's
quite
exactly,
a daunting task.
And we're actually recording activity from each one of those 140 contacts to try to identify where to stimulate, but identify what is the signal, the biomarker that tracks his pain.
And for the first time ever, they obtained a real-time pain map. What you're looking at is Ed's brain in pain. And then they passed an electrical current into Ed's pain centers.
Dropped to zero.
And watch what happened.
Both dropped to zero.
To zero.
Yeah.
You don't feel pain right
Don't
now?
feel nothing. I feel my feet.
Yeah.
Like I can, but
Yeah.
the pain's gone. Pain's stopped.
You're not kidding me.
I'm not kidding.
I believe you.
I'm not kidding. It dropped. I mean, it's barely hooking at a 1 on both of them.
That's incredible.
Yeah.
It was like a veil lifting. It was like a ton of bricks falling off your shoulders. It was all at once, all at once. And it was euphoric.
But that was the first time in a long time, Ed, that you had not been in pain.
Yeah. It's like the best drug I ever did, and I didn't do any drugs.
Right.
Yes, we were not expecting that at all. It surprised me how quickly he responded, but you hit a particular spot and it, changes their life.
I'm able to tell you exactly the number of my pain.
I visited Ed in his hometown of Albuquerque, New Mexico, to see just how much it had changed his life. Walking, exercising, just enjoying time out with friends, and also traveling the world with his music.
Hey, buddy.
Hey, what's up, guys?
He continues to meet with Shavalkar's team to monitor his implants remotely, checking in from New Mexico.
All right, there you go.
Nice, look at that, we're in here.
Since the brain is a dynamic organ, they are always tweaking the settings. He even felt it turn on during our interview.
I can feel the pain go.
Wow.
Yeah.
Geez, Ed, I gotta say, because I've been a neurosurgeon for, long time, I haven't heard that level of description before.
Yeah.
That's pretty wild.
Yeah, I think it's pretty much what makes me one of the first cyborgs in the United States. It's 100% changed my life. I mean,
Ed is a pioneer. Ed is one to help himself, but really to help humanity, to make this world better. And that's just, it's priceless to me.
I feel like I owe him my life.
Invasive brain surgery for pain. Obviously, this won't be an answer for the masses, but look at what we have learned. Pain lies in the brain. It is measurable, it is predictable, and preventable.
There's hope. A lot of scientists are tirelessly working around the world to try to make your life better in the next 5 to 10 years.
Okay, 5 to 10 years. We'll come back and check in.
All right.